Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I'm very pleased to welcome Dorcas Mukendi. Dorcas is a registered nurse with more than 6 years' experience. She's a critical care nurse. She's a legal nurse consultant. She's fluent in both French and English. And she notes that when she became a nurse, approximately 2 months before her 21st birthday, she could administer narcotics, but she couldn't drink. Dorcas is speaking to us this morning from South Carolina. So welcome, 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 Dorcas.
Thank you.
Thank you for doing this. Thank you for doing this. I appreciate it. But tell me, why? What brought you to nursing?
Well, my grandmother was actually a nurse. However, my mom was not a nurse. So when we moved here to the United States from Africa, I I didn't really want to be a nurse just because the conditions of nursing back home aren't like they are here. So I kind of pushed that aside, but my mom kind of tried to encourage me to do that. So while I was in high school, I signed up for a program that one of the local hospitals offered here where it allowed high school students to spend about 3 weeks over the summer where you get to shadow different, not just nurses, but different healthcare professionals. So I did that for those 3 weeks. And at that point, I felt more inclined to now give a chance to nursing.
Okay, so you had to be encouraged and nurtured into it, so to speak.
Pretty
So,
much, yes.
okay, so your mother encouraged you to do that, but what were you thinking you would like to do prior to this?
Ooh, it was hard because, we had just moved. When we moved here, I was still in high school. I was right at like ninth grade when we moved here. And you're in a new place,
Ah,
new language, new culture, new people. The system, the way school works here and back home is totally different. So I was
yeah,
just like kind of in the uncertain because I'm still trying to adjust to the new life here. And but 4 years goes by faster than we think sometimes. So before I knew it, it was already 11th grade and college is coming up and you have to decide
yeah.
what you want to do. I didn't really specifically have a particular thing I wanted to do. I was kind of strong in math in school, so I thought maybe I might go the math route or the science route, but I didn't know exactly what in those area, but I thought maybe something with math or science. And
Mhm.
then when I did that shadowing, I didn't just follow nurses. I followed other professionals and nursing was the one that stuck to me the most because I feel like nurses we serve people, but we also get to do a little bit of what everybody else does.
Yeah, yeah, yeah. I say frequently that our job description is everybody else's job description, or rather, the other way around. Everybody else's job description is also our job description.
Pretty much, yeah.
So, what challenged you though? As a new nurse, what challenged you the most?
When I was well, in school you learn enough to get started, and then you get to the actual place and you realize, oh, I only know this much, so I have to study even more. So that's where you get to learn to, if you're an introverted person, then it's hard. You have to learn to open up to people, be willing to ask questions, because if you don't, it's very easy to make mistakes
Yeah,
and
yeah,
and but yeah, the
yeah,
challenge I think was realizing that school didn't end just at school. You keep learning and learning and learning. Even
yeah.
today, even though I've been a nurse for 6 years, I'm still learning.
Well, I have news for you, my dear. I've been a nurse for 50 years. I'm still learning. Yeah, what you realize that is as difficult as you thought school was, it really is the kindergarten of nursing.
Yes.
So, what areas did you work though in
So
these
when
6 years?
Yeah, I finished nursing school. I worked at a little post-acute rehab hospital. So patients are inpatient over there. Those nurses are able to administer IV medicines, but they're not still in the acute care setting. They just kind of
Mhm.
as if you were gonna go home on IV antibiotics or,
Yeah.
need nurses for wound care. So they're inpatient at the rehab center, but they spend a lot of their time doing physical therapy, occupational therapy, speech
Mhm.
therapy. And those patients were mostly patients who had stroke or amputations, back surgery. I did a year there. Then I moved to a hospital. I worked med-surg for 4.5 years. Then last year in May, I moved to ICU.
Okay. So now you're still currently in ICU.
Yes.
Okay. All right. And then you became a legal nurse consultant.
So I just started that like as of this month. I was taking my courses and I just finished last week. So I haven't actually taken any case yet. So my only knowledge is whatever I got from the course and what I see others post and share, but I haven't personally worked in it yet.
Yeah, but what made you pursue that avenue?
So, well, after working so many years at the bedside, I kind of got a little burned out, but I
Ah,
still love being a nurse. Believe it or not, last year I was looking to do something totally different than nursing, and I was looking maybe I should try something like graphic designer or something else. And I was looking at colleges and everything to see what courses I could take. But then I sat down and I said, well, I went to school to be a nurse. I wish I could find something that I love to do where I can still use the degree I went to school for instead of taking a totally different route. So I had seen the stuff about legal nurse consulting maybe 2 years ago or so, but then I just discarded that. And then it kind of came back to my attention. So I started looking really deeply into it. And I love doing detective work, just like on the regular basis, just trying to
yeah,
figure out why this is happening and just in my regular life. So I said, well, I could put those skills into something valuable. So
yeah,
that's
yeah,
kind of how I started that.
yeah. That's the thing. That's the thing about nursing is that, you can get burned out. That's true, but there are so many other areas under the nursing umbrella where you can work. You can just work anywhere and absolutely do anything, in fact,
Yes.
um, as a nurse. So good for you. You found another niche. Oh, in those, so you said that you've been working for 6 years, 6+ years as a nurse. What, based on your own experiences, what do you think you would like to see change?
I think the number one thing I would love to see more than anything, of course, everybody would love to be paid more and everything, but I think if we could have good staffing every single day, that would make a huge difference. That's the number one thing I would change before anything else. And I've been to 3 different hospitals now, and I've noticed that it's an issue everywhere.
I was just about to say that. I was just about to say that it is an issue. It's an issue that we've been talking about for years. And so you're coming into this with kind of a fresh perspective, so to speak. And I want to ask you what kind of because it strikes me that we're going to have to get really creative if we
Hmm.
want to address the shortage of staff and the heavy workload and stuff like that. How creative, what kind of creative things you think we can do to address even one of those things?
Well, first of all, where the population is growing, the amount of sick people are growing, the amount of people who need healthcare is increasing. So we need the amount of nurses for that, you know. And sometimes we're able to fill the staffing needs, but most of the way we accomplish that is by having people work extra shift and we're giving them
Yeah.
incentives and money, but that's not solving the issue per se because those nurses, yes, they are helping fill the shift needs for that day. However, they're working more than one person should technically work in order
Yeah.
to have a happy life. Because
Yeah.
you still have you need life outside of work. You need rest.
Yeah.
Um,
Yeah. Yeah. So on that same note and in that same vein, do you see uh technology in any way being able to relieve some of the burden? How?
hmm. I think the job that nurses do, it kind of. I'm sure there could be a way for to. I mean, today doctors do laparoscopic surgeries where it used to not be done in the past. So, and I'm pretty sure somewhere in the world somebody has used a robot to do some kind of procedure. Um, I wouldn't say that it's not a thing. I have seen or heard that there are some hospitals that have robots that pass around and pass meds to patients. I'm not sure. So I'm sure there's a way that they could someday come up with things to reduce the
Yeah.
load of nurses, but we
Yeah.
would have to see how that would work. I haven't personally experienced that. Um,
Yeah, we are incorporating technology more and more into the way healthcare in general, not just nursing, healthcare in
yeah.
general is actually, delivered and approached. But then, what is your big vision to go back a little bit to your legal nurse consultants thing? What is your big vision for that? Because
Um,
just spent some time learning to be an eager nurse consultant, building on your nursing knowledge. So what's the big vision?
what was the vision? I would love to be able. I think I've seen legal nurses that work with both plaintiffs and defense. So I would love to. I think at first I want to work with both defense and plaintiffs, but I feel like I kind of want to lean more towards the plaintiff side, just because I see so many wrong things going there. And of course, the plaintiffs don't always go against medical providers in medical malpractice. There's other things like, workers' compensation and personal injury. I just, just like those lawyers that are helping those
Yeah,
clients, those people came because they need help and they need somebody that can find what could be helpful to them. The lawyer takes care of the legal stuff, and me as a nurse, I'll be able to try my best to dig into those shorts and find what could make a difference for them.
yep, indeed. Yes,
And to
indeed.
to me,
Yes,
it's kind of I feel like taking care of the plaintiff side to me kind of still feel like being a nurse at the bedside and being a patient advocate.
yeah, 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 exactly, exactly. Yeah. So you're 6 years in, you spoke about, just in that time you experienced burnout.
Mm-hmm.
Number one, speaking of burnout, then what do you do? What have you learned from being burnt out, and what do you do to take care of yourself?
When I first started that first year, I was very excited to be a nurse. Then you when you start the nursing job, you see the money. A lot of people don't make that money as when you as your first job. But then you start getting excited about these extra shifts that they offer. So I signed up for them. I would work 4 days a week. I attempted a few times 5 days a week. Then I realized I was super tired. I was not happy. Then I started decreasing, and I would still pick up a few shifts, but eventually I would just do half shifts because I realized that those extra shifts were just adding to me being too much at work and not having so much of a personal life. Eventually, now I don't even pick up extra shifts anymore. It's just my 3 shifts and that's it. If I need more money, I usually just try to make it work with whatever I get from my regular shifts. Um, but about 4 years ago, I started as an adult, I started figure skating, but I was just starting it like a little hobby. I would go like once a week and stuff. But I found so much happiness in there that I spent almost all of my days off on the ice skating and learning new skills. To me, that's not only it's sport, it helps me release those endorphins and be happier.
Yeah.
I'm learning something new every day and it's a
Hmm.
challenge and it's not work. That's the number one way I try to get away from all this. And then sometimes I'll read too, and I also like traveling with my family.
Excellent, excellent. That's a good way to go. That's a good way to go. What advice now would you give to someone? You've just completed nursing school a few years ago. You started working. What advice would you give to someone who wants to be a nurse?
I would tell them that nursing is a very rewarding field, but it's definitely not for everybody. So you have to go with a very open mind and realize that there will be happy days, but there will also be sad days. And remember, always remember that the only way to take care of others is for you to take care of yourself first. Because if you're not well, how are you going to give your
Yeah,
some of yourself to others?
yeah, yeah, yeah. Yeah, take care of yourself first. Take and listen. Learn to listen to your body in taking care of yourself. Learn to listen to your body. Very often we don't listen until we wait until our body is shouting at us before we do something. So one more question. If you could describe for me what you think of as the most essential quality of a nurse, if you could tell me in one word what that quality is, what would that word be?
I think I would choose the word patience
Patience. Okay, yeah.
because you will meet all kinds of patients. You will meet all kinds of doctors that you have to deal with, and patience sometimes is your only way to deal with
Yeah,
all these multiple personalities
yeah,
you
yeah,
encounter.
yeah, yeah. It is a high stress situation. You're dealing with people who maybe this is their first encounter with the healthcare system. Maybe they've just had a devastating diagnosis, or maybe there's something happy that's going on. They just had a new baby. In any case, there's a lot of emotion, running through
Yes.
that. And, a lot of the result of that emotion gets directed at you, whether it's pleasant or unpleasant. So,
Yeah,
yeah,
because
and then you need the patience.
I feel like every nurse can pass meds, every nurse can put in IVs, every nurse can, but dealing with
Hmm?
that situation individually with the patients, the way they react, I think sometimes the only way to let our emotions not get involved is to also learn to be patient
Yeah.
with them and understand them, put ourselves in their shoes.
Yeah. 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 You have to learn to walk in someone else's shoes. It's a big
Yeah.
part of who we are as nurses. So, Dorcas, before we go, any wise words you want to leave us with?
Um, I guess I would say whatever you want to do or dream about, always give it a try and don't give up, whether it's nursing or legal nurse consulting. But the big thing is always do a lot of research into, like for me, nursing school. A lot of people come into nursing and they don't even know what to expect. So definitely ask around to other nurses, do research on schools, hospitals to get a feeling and know whether that's for you or not. And if you feel like it's for you, you will definitely find a way around all the challenges. Um,
Hmm?
but don't give up, sure.
Okay. Good one. Good one. Good one. Do your research. Make sure you know what you're doing.
Yeah.
Yes. Thank you so very much, Dorcas. This has been an enlightening conversation. I truly enjoyed it. Thank you.
Thank you.
My pleasure.